Maybe it was the pandemic or presidential politics, or you're worried about what's happening in Ukraine or something else. It seems like everyone is stressed out. And as a teacher, I have seen a significant increase in students saying they just can't complete assignments because they are so overwhelmed by life. On this episode of Rocket Talk, we're talking healthy ways to deal with mental health issues, and we're discussing what you can do as a parent, friend, or family member if you're worried about someone you love. Our guest today, Dr. Peter Mezzo, an associate professor and licensed clinical psychologist in the Department of Psychology. He's the associate chair and interim psychology clinic co-director. Research interests include self-regulation, coping skills, and psychological treatment of distress, and the promotion of mental health and well-being. And my close colleague and friend, Dr. Lisa Bowman, she's the one students come to when they're overwhelmed. Our students come to when they're overwhelmed with their classes and they have to make those tough scheduling decisions. She's the Department of Communications academic advisor, helping students plan academic schedules and careers. She also teaches here and is a professional clinical counselor. Thanks so much for both of you, for being here today. Dr. Mezzo, what is the biggest reason why people don't seek help, and how do you address that?
That's a great question, and I would hesitate to say there's only one reason or a major reason across all people. I think it can probably vary, but I mean, sometimes it's around stigma around mental health, and people might feel embarrassed or might feel uncomfortable to seek out help. There can be other barriers, for example, the cost or the perceived cost of getting help. So it's very important to kind of keep that in mind when we try to let people know about the availability of services and try to address those barriers. Trying to do things like normalize the fact that a lot of us are in distress, a lot of us have anxiety and depression. Trying to make sure that there are affordable and accessible ways to receive mental health services.
Do you think the stigma is maybe not as significant as it was just 10 or 20 years ago? At least it seems like that in my lifetime.
I think so. I think it's improved. And again, this will vary by groups of people. So maybe in some groups in our society, there's less stigma, and others maybe it hasn't changed as much. So it's important to kind of keep that in mind as well.
Dr. Bowman, you are advising students daily. What big issues are they facing? What are you hearing from them? And side note, if I asked this question 5 years ago, pre-pandemic, would your answer be different?
Well, I think students are facing typical challenges when they adjust to college. They're learning how to live independently. They're learning how to be away from their primary support system, some of them. They're trying to make decisions about their future, their potential careers. And then on top of it, we've had a public health crisis, environmental distress, social and political unrest, all in the past few years. So I would say they're not feeling as hopeful about the future as they might have felt in the past. Some pessimism about the future.
So, Dr. Mezzo, if I'm concerned about someone I love, but I don't want to push them away or maybe cause more harm, how do I approach that?
So that's where the relationship becomes so important. So if you care about somebody, I think a very important first step is to let them know that, to let them know that's why you're speaking with them about perceived distress, is that you really care about them. And then in addition to that, exploring with them how you've seen maybe some of the struggles that they've had and how maybe it would be helpful for them to seek out help. But I think that really first key part is to express that you're doing this because you care about them and not because you're trying to confront them or put them into a difficult situation.
And kind of along those lines, Lisa, what should parents do, especially if their kids are a little older and they want to give their kids autonomy, give them some space, but they feel like, this doesn't seem right?
I think it's important for parents to recognize that they know their children really well. And if they're noticing a behavior change, their child isn't acting like they normally do. They've suddenly become withdrawn, they've had a change in sleeping or eating habits, they're not in contact maybe with the parents as much as they have been if they're living away. They're not doing the things that they used to love to do. I think it's important for parents to express, like Dr. Mezzo said, we love you, we care about you, we want you to be okay, and I'm noticing this lately in your behavior, and I want you to know that I'm here for you. and I'm always going to be here for you. So I think it's providing that support and encouraging them to seek out resources. So if parents know that we have the counseling center and the psychology clinic and other resources in the area, they can encourage their children to seek those services on campus as well.
So you're saying even if it's an adult child, a young adult, someone in college, 21, parents should still be involved?
They should be there. They should always be in their son or daughter's corner, just to kind of let them know that they're there for them when they need help. And certainly students want to try to solve problems on their own, but it's nice to know that the parent's there in a consultant role.
Okay. Dr. Mezzo, what are the signs that professional help is needed quickly? Maybe suicide prevention or something like that.
Well, so there are different degrees of concern, I think. Suicidal ideation or thinking about death is not necessarily a very urgent matter. It can be, but not necessarily. Many people do have fleeting thoughts of that nature. What really raises a lot of concern for a lot of people is if there are means. So if there are fatal means, like a firearm is available, other kinds of means where someone can harm themselves, that becomes a highly risky situation. It's also of concern if somebody, as we've heard, becomes very isolated, pulls back, and is not really interacting with other people. Those are red flags. And clearly, any clear intent to harm oneself is a red flag.
So I personally have had a bad experience with a counselor in another state, and I've heard from a lot of my friends that it's pretty common, actually. If someone tried counseling once and maybe it didn't work too well, or they're in counseling or therapy now, but they don't seem to be making a lot of progress, does that mean it's the professional's fault, or sometimes do we need to do some self-reflection if we feel like progress isn't being made?
Self-reflection is never a bad thing, in any relationship in life. But that being said, I think, in a counseling or in a clinical relationship, it really should be thought of as a team effort. So it's really important that a client feels like they can collaborate with a therapist. And so if that isn't there, then that's, I think, something that can be a really open discussion between the client and the therapist. And it may very well be that some client-therapist relationships just don't work out, but that doesn't mean another one can't. And so I think it's important to appreciate that we do have psychological treatments that have been shown to help people in really quite severe distress. And so if you haven't been able to receive those services in a particular relationship with a therapist, it is very much worth it to maybe seek out another therapist.
So are there certain things that people should be looking for, or questions that they should be asking when they're searching for a new therapist?
I think, as with many other things in healthcare, it's good to be an informed consumer. So I think it's very worthwhile to find out a little bit more about what kinds of treatments have been shown to work for things like depression and anxiety. I myself have a background in cognitive behavioral therapy. Many of those variants of cognitive behavioral therapy have been shown to be quite helpful. So that's worth researching ahead of time if you're exploring for a therapist, is what kinds of services might they be able to offer you. And then, regardless of what they're offering, it's important to have rapport. It's important to have a relationship with your therapist. So when you're thinking of who you want to work with, on that initial session or the first couple of sessions, you can kind of explore whether this is somebody that you can kind of work together as a team.
We'll have the last question go to both of you. Dr. Boltman, we'll start with you. For the younger adults, the college students, we know the pandemic was difficult. Research tells us that, but we don't even need research to tell us that. It was hard on everyone. Do you feel like students are getting better, from what you're hearing in the office? And do you think that things will continue to get better? And what do you say to students? That's
my hope, that things will continue to improve in our society. Even something as simple as not having masks on and seeing students' faces for the first time in a couple of years seems like it's made a difference. Getting some more social activities back on campus, students are able to connect more with one another. I think that's increasing the optimism. Are they more hesitant to get involved because maybe they haven't been at all for the last 2 years in any? I think there's some hesitancy, but also some excitement and surprise. Like I can actually go to a student organization meeting, for the first time in my college career, because some of the students started when the pandemic started. So they've had 2 years of college under a lot of restricted situations. So to have that open back up is nice for them.
And how important is that when someone is planning their academic career? I tell my students, if you only go to class and that's all you do, you're cheating yourself so much.
Yeah, they're not enriching their college experience, and it's a really big part of their growth.
So Dr. Mezzo, what do you say to young adults or parents of young adults, maybe to push them back out there again?
I would definitely agree with getting back out and doing things. Sometimes it can happen in a gradual way, but we know from the research that when people are depressed and they don't engage in activities, the depression will deepen. And conversely, if someone's depressed, if they start doing a little bit more than they used to, then that depression can actually lift.
Okay. Well, doctors, thank you so much for coming on the program and sharing your expertise. That's all the time we have for today. Thank you for joining us, and we'll see you next week with more Rocket Talk from the University of Toledo.